over with you exactly what are the three different types of mindsets that you need to have in order to pass your NCLEX exam. Hi, my name is Nurse Choma, and in this video, I'm going to be going over with you what are the three mindsets when it comes to passing the NCLEX exam. All right, so let's get right into it. And as always, make sure you hit the like, subscribe, and turn on your notifications so that way you don't miss out on more of these videos. The first and number one is that you need to be optimistic. All right, you need to be positive, you need to be hopeful, right? Many times when I talk to people and they reach out to me for help, like, oh, I'm so defeated, oh, I feel I give up, I'm so discouraged, it's so hard. And you really honestly have to push yourself through those feelings, honestly, because the reality is that you're gonna either settle for the pain of failing a few times, a couple times, or whatever, versus going after your dreams despite those situations, right? Because it's either you're going to be okay with failing your test and being in that situation, and be in that situation, and which means that you have to constantly explain to people why you didn't pass your NCLEX exam. Wait, you went through nursing school, I thought you finished nursing school. And it's not even people's opinions, it's also the reality of not being able to take care of yourself financially, not be able to take care of you and your children financially. It's that pain that's way more painful, as opposed to pushing yourself and doing it again, trying it again, despite what it's looked like. And you would be surprised how many people are in your same situation, right? So be optimistic, be hopeful, be positive, right? Listen to positive things, watch positive videos, read positive books, whatever you have to do, and avoid telling other people that are negative or naysayers, right? That's why I usually encourage people that if you're getting ready to take your test again and you failed it before, then please, by all means, do not announce that to other people. Do not tell other people, hey, yeah, I'm going to take it on the first, or I'm going to take it in a couple of months. Don't tell anyone. Unless you know with 100% certainty you can trust that person, don't tell anyone, because a lot of times it will honestly just sabotage you. The second thing, number two, that you need to have mindset is that you need to have strong keyword analysis. All right, what do I mean by this? So now I'm going to give you two different examples, and it's going to help you to get more context and see things a little bit differently. So you have to be able to look at the question and identify all of the relevant keywords in the question. For a lot of people, this is something that they struggle to do or don't realize that they're not doing it, right? So for example, and in another, if in my other videos where I go over different practice questions, I go over practice questions. That would be a more better example where you can see how I illustrate this. But keyword analysis simply means being able to look at the relevant keywords and identify what they mean and how it relates to picking the best answers, right? And I've seen many times that people that are from that went to school in different countries, or English is not their first language, they may struggle with this as well, because they need to be more well versed with medical terminology, right? There's something called root meaning, ROOT. Root meaning means that you're able to pretty much look at the root of the word, the prefix, the suffixes, and analyze, I should say, what that meaning is. And that's one thing that has helped a lot of my repeat test takers pass their exam, is they're being able to look at the root meaning and teaching them how to do this, right? So that's going to be the second thing, is strong keyword analysis. Number three, the third thing is going to be, honestly, if you're a safe nurse. Safety, thinking more safety. That's another huge thing. So what I mean by this is that a lot of times when people are trying to pass this exam, the way they look at the test, they look at it from the point of view like the test, the NCLEX is like a villain, like the NCLEX is the enemy. When in reality, you have to realize that no, the NCLEX is literally the barrier between you and the general public, right? That's essentially what it is. Because what that means is that once anybody passes their boards, you have direct access to be with real patients, and now their lives are in your hands. So they want to make sure that you're safe, that you are a safe person to for them to issue a license to be able to take care of real life patients. That's how to look at it, right? So for example, let me give you an example. Let's say there's a question and the question says that the patient has a blood sugar level of 45 and you pick the answer that says continue to monitor, take the vital signs, check back in an hour, right? All of those, if you pick any of those type of answers, that indicates that you're not a safe nurse. Because it shows that one, you don't recognize that this is a hypoglycemia patient. Two, you don't recognize that this requires emergency response, right? You don't recognize that there's going to be an increased mortality risk if you don't do the appropriate interventions, right? So the appropriate intervention would be give the patient D50 immediately, right? If they're not responsive, immediately into their IV, immediately, right? Or have them drink something, eat something right away, right? So this is the thing is that the test is trying to see if you are safe. And if you're not able to recognize that in the questions and how you pick the answers, then you're going to struggle more when it comes to passing the exam. Comment below, let me know which of these three things that you feel like you're struggling with when it comes to the NCLEX mindset